Researchers at the ongoing International AIDS Conference in Berlin have advocated countries to include people living with HIV/AIDS in the priority group and the COVID-19 rollout. Bassey reports that while appealing to the global community to bring COVID-19 vaccines to countries with high prevalence of HIV, participants say it is unacceptable for less than 3% of Africa that has received a single dose of COVID-19 vaccine, and less than 1.5% have received 2 doses. Her report.
About 35 million people have been reportedly lost to HIV and AIDS since the first reported case of the disease 40 years ago, and the pandemic, experts observed, is still ravaging. This is why the 11th IAS HIV Science Conference is focusing on the critical issues that affect HIV response in order to address the scientific gaps that exist in the face of COVID-19.
Just 40 years of HIV experience inform the COVID-19 response. The scientific breakthroughs and political will achieved in that response must now propel our efforts to end HIV.
The same investigators who had worked for years trying to develop an HIV vaccine used those technologies of structure-based vaccine design to get the precise pre-fusion conformation of the COVID-19 SARS-CoV-2 spike protein, which now we know has been extraordinarily successful in the development of COVID-19 vaccines.
German chancellor said HIV must not be allowed to fade in the background because of COVID-19, stressing that the fight against AIDS can only succeed through global cooperation.
Die auch zu einer Erhöhung der HIV-Infektionsrate geführt hat.
The international community must redouble its efforts to reach the global sustainable development goals relating to HIV.
While expressing optimism in ending AIDS in 2030, speakers agreed that global pandemic requires global response and stood for the cooperation of all in the fight against the pandemics. Bassey, NTA News.
Now speaking further on some core issues on the International AIDS Society HIV Scientific Conference is the co-chair of the 2021 conference, Dr. Hendrik Streeck. Dr. Hendrik Streeck, you're welcome to NTA International News.
Good evening, Nancy.
Thank you so much. Now, what actually informed the 2021 International AIDS Conference?
Well, I think the spotlight was really, or is really, on the co-epidemics of COVID-19 and HIV. And there has been troubling reports by the WHO that showed that HIV is a significant independent risk factor for severe COVID-19 illness and death. And in this study, they analyzed more than 15,000 people living with HIV who were hospitalized because of COVID-19. And this report just underscores the importance of including all people living with HIV in the priority list #1 for national COVID-19 vaccine programs.
Thank you very much. Given the myths and misconceptions lurking around, what can you say about the efficacy of COVID-19 vaccines?
Well, the COVID-19 vaccines are safe and efficacious in preventing severe COVID-19 disease. So I think it is important for everyone to realize that the vaccine prevents yourself from getting seriously ill. In simple terms, the vaccine actually contains only a small fraction of the virus produced basically chemically. So one can choose to either get the whole virus and get infected with the virus, or only get the small part from which we know they are safe and don't make you sick. And we have seen this by millions of people worldwide that have been vaccinated, including myself, that this vaccine is safe.
Thank you very much. The vaccine is safe. You have certified that. Now, how has 40 years following the science in HIV benefited the response to COVID-19?
Well, you know, the response to COVID-19 has benefited from years of HIV research in many, many ways. We would, for example, not have a vaccine so quickly without HIV research. And the tests to detect COVID-19 were developed based on the original test, how we were detecting HIV. And also the treatment stems from the field of HIV research. However, it can go also the other way around. What we have seen now for the COVID-19 pandemic and COVID-19 response, that if we have strong political will to end a pandemic like the COVID-19 pandemic, we can actually end it. And I think now there needs to be the political will to end the AIDS pandemic, and I hope that we will gain this momentum after this conference.
Thank you so much, Dr. Hendrik Streeck, co-chair of the 2021 conference. Thank you so much.
Thank you.
This is news.